Our decision in the previous video was to reject our null hypothesis that Paul the Octopus isn't just randomly guessing who's going to win these soccer games. And our conclusion then is that there's strong evidence that Paul knows something, or at least is better than 50% at predicting the outcome of a soccer game, which, since Paul isn't a person, Paul is an octopus, likely not true, which means that our hypothesis test led us to make a mistake. We reached the wrong conclusion. And our statistical inference methods aren't infallible. Sometimes they'll make mistakes. The goal of a lot of these methods is to minimize the chances of making errors, but sometimes they still happen, and they're worth talking about. Well, when we're working with a hypothesis test, since there are two hypotheses and two decisions that we can make, that means there's a total of 4 possible outcomes out there. There are 2 options for the truth. Either the null hypothesis is right or wrong, and then the decision we make. Either we're going to believe the null hypothesis is wrong, or we're not going to believe the null hypothesis is wrong. 2 times 2 gives you 4, so 4 possible outcomes. If the null hypothesis is false and we reject it, that's a good decision to make. We rejected a wrong belief, and hopefully we believe the correct one in the alternative hypothesis. Or if the null hypothesis is actually true, that Paul the Octopus is probably blindly guessing at 50%, and we fail to reject it, that's also good, because then we didn't incorrectly rule out the null hypothesis that's actually true. However, if we reject a null hypothesis when it's right, or fail to reject the null hypothesis when it's wrong, we can make one of 2 errors. And you can see here they're called type 1. The type 1 error is when you reject the null hypothesis when it's actually true. Tend to think of those as like a false positive. The test comes back positive, saying that there is a difference between what we see and what we believe in the null. But it's a false positive because it shouldn't have come back positive. We shouldn't have rejected the null hypothesis. And then a type 2 error is what I tend to think of as a false negative. The test comes back saying there isn't any difference between what we see in our sample and what we believe in the null hypothesis. But again, it's a false negative because there really is a difference between reality and what we believe, and what's the truth, and what the null hypothesis says. And someone came up with these errors a long time ago. There's 2 of them, so they didn't really feel like naming them something fancy, so they just called them a type 1 and a type 2, but doesn't really help explain which one's which. I'm not going to expect you to memorize which one's a type 1 or a type 2. I've been doing this for 12 years, and I still have to think about it, which one's a type 1 and a type 2. But you want to be able to think of what are the consequences of the different mistakes that we can make. So, for example, a lot of our medical tests, like a pregnancy test, are essentially a hypothesis test. They're just not a statistical one. They're more of a biological hypothesis test, where our null hypothesis is we usually believe the person doesn't have the condition, or in this case, the person's not pregnant, where our alternative hypothesis is that they are pregnant. The test goes in assuming the person is not pregnant, and then it's going to actually look for evidence in certain fluids that they are pregnant. And I like this image because it kind of sticks in my brain when I'm thinking of which one's a type 1 and a type 2. So a type 1 error is when the pregnancy test comes back positive, saying that the person is pregnant when they're really not. And a type 2 error is what we called our false negative. The test comes back negative, saying the person's not pregnant when they really are. And if you've ever seen the TLC show, I Didn't Know I Was Pregnant, then you can figure out, or you can see examples of situations where the test comes back negative, saying the person's not pregnant when they really are, and they don't find out until several months later when they're giving birth that they were pregnant the whole time. But for the most part, a type 2 error here isn't that bad because eventually the person will figure out, usually, that they're pregnant. But sometimes an error can have a little bit more of serious consequences, especially when we're dealing with more fatal conditions, such as a cancer test. Let's say a patient walks in, something's wrong with them, they're not sure. The doctor recommends getting a cancer screening. So our cancer test is going to be another hypothesis test. If you pull a person randomly off the street, they probably don't have cancer, so we'll also assume that the patient doesn't have cancer. That's our default belief. We're not looking for evidence that they don't have cancer. We're going to be looking for evidence that they do. So we'll assume no cancer. And then our alternative hypothesis then that we need evidence for, that the test has to find compelling reason to believe, is that the patient does have cancer. So the test looks for actual evidence in blood work, in biopsy cells, etc., whatever the test is extracting from the person. So in our case then, a type 1 error is always going to be a false positive. The test comes back positive, meaning it's going to say that the person does have cancer, but it's false, so that means the patient really doesn't. So a patient's going to think they have cancer when they really don't have it, which means they're going to be stressed out for a couple of weeks. And usually what doctors recommend when you have such a serious diagnosis is to get a follow-up. And usually the follow-ups are something a little more invasive, a little more painful, and more expensive. Instead of just a small biopsy, maybe they actually cut you open and do some exploratory surgery. Or maybe they do a more expensive CAT scan or MRI scan. So that's going to be the cost of a mistake for a type 1 error. Patient is stressed out and they waste time, money, and pain finding out that they don't really have cancer and fixing the mistake of the first test. Well, a type 2 is always going to be a false negative. The test comes back saying the patient doesn't have cancer. False means that they really do. So in this case, a patient with cancer is going to think that they don't have cancer. And generally, the way cancer works is if you don't treat it, it gets worse. And if you don't find out you actually have cancer until it's too late, the patient can potentially die. And when you're comparing the worstness of two mistakes, generally the one that leads to people dying is the worst consequence. So in this case, the patient dying is going to be the error we would like to avoid more often. Because in statistics, we can't really avoid both of these mistakes at the same time. You can either make it easier to commit a type 1 error, but if you do that, you lower your chance of a type 2. And in this case, that's the way a lot of cancer tests work, is that they would rather say a patient has cancer when they don't than the opposite. So these initial tests, anyway, tend to come back positive more often than they should, just because it's better for a patient to go through with a follow-up than to not go through with a follow-up when they really do have cancer, get worse, and die. So this is an example of when a type 2 error is the worst mistake. We'd rather have a false positive. We'd rather have a false negative. We'd rather have a false positive than a false negative. But some hypothesis tests, a type 1 error is the worst mistake. So for example, let's say we're looking at a jury trial, and specifically a case where the defendant has committed murder, so they're up for the death penalty. Well, in the United States, for the most part anyway, we're led to believe that the defendant is innocent until proven guilty, and that's what the jurors are told to believe, that without any evidence, the jury should believe that the defendant is innocent. So our null hypothesis is what we believe without any evidence, and the alternative hypothesis is what we're going to believe if the evidence is compelling enough. And that's the goal of the prosecutor. The defendant doesn't have to show they're innocent. The prosecutor has to lead the jury into believing that the defendant is guilty. Well, a type 1 error is a false positive. So in this case, the jury is going to find an innocent person guilty. Meaning what's going to happen is that someone who didn't actually commit the crime goes to jail. And since they're up for the death penalty, maybe they get falsely executed for a crime that they really didn't commit. Now, if that's the case, essentially now the crime has two victims. The initial victim, and then the one whose life is turned upside down and potentially ruined, or even worse, ended by going to jail. Whereas a type 2 error is a false negative. False meaning the person's guilty. Negative means the test comes back saying that they're not guilty. Again, we don't say that they're innocent. The jury just comes back saying not guilty. Which means that a person who committed the crime, a criminal, is set free and they potentially can go out and commit more crimes. And in the eyes of the justice system anyway, having a crime with two victims is worse than having a crime with only one and having the criminal go unpunished. So it's set up to where we're more likely to commit a type 2 error, letting a guilty person go free, than commit a type 1 error and putting someone in jail who didn't commit the crime, unless you're in Texas or somewhere like that anyway. So that's the idea of what a type 1 and a type 2 error are. False positive, reject the null when you shouldn't. Type 2 is a false negative, you don't reject the null when you should. And which one is the worst error all depends on the context of the problem. Well, since a cancer test, a false negative is the worst case, and in this example with a murder trial, a false positive is the worst error to make. How do we go about controlling for our chances of committing a type 1 or a type 2 error? The nice thing is if your type 1 error is the worst mistake to make, you control the chances of committing that exactly, because that's what our significance level is. If we reject the null hypothesis with a significance level of 1%, and the null hypothesis is actually true, that means 1% of the time you'll reject the null hypothesis anyway, because this alpha is our significance level. And that usually represents the probability of rejecting the null hypothesis when the null hypothesis is actually true. So if we're at a murder trial and we set our significance level to 0.1%, or 1 in 1,000, that means 1 in 1,000 innocent people will be jailed. If you set your significance level to 1%, that means 1 in 100 innocent people will be jailed. If you set your significance level to 10%, 1 in 10 innocent people will be jailed. The lower your significance level, the fewer and fewer innocent people that will end up going to jail. But if we're looking at our cancer test, the lower your significance level, the fewer false positives that there will be, the fewer people who don't have cancer. The test will come back saying that they do, which is also a good thing. But the problem that we run across is if you lower your significance level, it increases your chance of a type 2 error. Well, if our chance of a type 1 error, we use the Greek letter alpha, our chance of a type 2 error, we'll just use the Greek letter beta. And in this class, we're not going to calculate what the chance of a type 2 error is. You can, but we're not going to do it. That's usually reserved for a second course in statistics. But we are going to discuss a couple of things you can do to lower your chance of a type 2 error. Well, what can we do to lower our chance? So the problem with just choosing a really small significance level is that decreasing alpha results in an increase in beta. If you make it harder to commit a type 1 error, you're making it easier to commit a type 2 error. You want to remember, the lower your significance level, the more compelling evidence that you're going to need to change your mind. So if a cancer test wants to be really sure that the person has cancer before it comes back saying that they do, what that's going to mean is they're going to make it much more difficult for a person who actually has cancer to get a positive result. So requiring more evidence to reject your null hypothesis makes it harder to reject the null hypothesis, which ups your chance of committing a type 2 error. So if a type 1 error is the worst mistake to make, you can choose a lower significance level. If a type 2 error is the worst mistake to make, you can increase your significance level. So maybe for a cancer test, we have alpha equals 10%. But for a death penalty trial, maybe we have alpha equals 1%. Or if you don't want to execute 1% of innocent people who end up going to trial, maybe you could do 0.1%, where you only execute 1 in 1,000 innocent people who go to trial. So lower your significance level, harder to commit a type 1 error, but easier to commit a type 2, meaning that if the person actually did commit the murder, you'll let a lot more of them go. Well, what can we do if we don't want to increase our chance of a type 1 error, but we do want to decrease our chance of a type 2? So the only way to lower your type 2 error without increasing your type 1 error is to increase the sample size. And for the most part in statistics, as long as you're taking a random sample or doing a randomized experiment, larger samples will fix a lot of our problems. Larger samples don't lower your chance of a type 1, but larger samples do lower your chance of a type 2. And we'll see that in the next video, kind of what it's doing with our hypothesis test, why a larger sample lowers our chances of committing a type 2 error. And I'll also use a bit of a metaphor in the next video as well.